All right. Hi, everyone. We are opting, instead of a Facebook Live, we are doing a live Q&A here with Dr. Gupta and Tanya Bronzell-Wynder. And we're doing this because this is April, which is Sarcoidosis Awareness Month. And so we're doing some frequently asked questions about sarcoidosis. So my name is Heather Greaves. I'll be interviewing or moderating this discussion today. And I'm joined by Dr. Rohit Gupta, who is a pulmonologist here at the Temple Lung Center. He is also the director and the founder of the Sarcoidosis Program here at Temple University Hospital. Hi, Dr. Gupta.
Hey, guys.
And Tanya Bronzell-Wynder, who is a nurse practitioner here at the Temple Lung Center, sees many patients with sarcoidosis, and she also has started and manages the sarcoidosis support group here at Temple. Welcome, Tanya.
Hello, everyone.
So, like we said, we're wearing our purple today. It's Sarcoidosis Awareness Month. This is a condition that affects an estimated 175,000 people in the US, and it's very difficult to diagnose. So that's probably a pretty low number, right? There's probably a lot of undiagnosed patients out there as well. But Dr. Gupta, tell us exactly what is sarcoidosis?
Yeah, thank you, Heather, for the question. And thank you, guys, whoever is watching this. This is, as Heather said, Sarcoidosis Awareness Month. We're trying to spread some awareness about it, a disease which can be sometimes fatal and a lot of times underestimated and undermined. So sarcoidosis is an inflammatory disease which can involve multiple organs of the body. When I say inflammatory disease, that means that some trigger, unfortunately, we don't know what the trigger is clearly, trigger or triggers are currently at this time. But whatever the trigger or triggers are, they start the inflammatory process, which leads to widespread inflammation, and the presentation and prognosis is variable.
And so what parts of the body can sarcoidosis affect? What organ systems?
Yeah, so that's an interesting question, because a lot of times patients will have pulmonary disease. So more than 90% of the cases would have some sort of pulmonary involvement. At the same time, this disease being so variable, many patients we see multi-organ involvement, meaning multiple organs of the body are involved, which can include very worrisome organs like heart or the brain, as well as sometimes involving liver, spleen, other type of diseases like joint inflammation, etc. Eyes are very common as well. Lymph node involvement are very common as well. And again, a widespread presentation is very common too. So many times when we look in a patient who has come in just with pulmonary symptoms, they might actually have other organ involvement as well.
And so, I imagine that since this condition is so variable, that the symptoms, depending on the patient, would also be variable. But what are the most common symptoms that you find?
Yeah, so that's exactly right. Depending on the organ system involvement, your symptoms will vary. Again, because the most common organ system involvement is lungs, we see pulmonary symptoms, so lung symptoms, including cough, shortness of breath, chest tightness, wheezing. We might also see generalized fatigue, weight loss. Again, depending on the organs, if eyes are involved, you can see redness or pain in the eyes. Sometimes swelling of the glands is felt by the patients themselves. Skin rashes are fairly common as well. So again, these are kind of the common ones, but they can be very non-specific generalized symptoms. They can be localized to one organ system, or they can be multiple organ presenting as multiple symptoms.
And then who typically gets sarcoidosis?
So so this disease is still enigmatic because it is an old disease, but still remains not well studied. What we have seen is multiple studies throughout the world have shown us that both the sexes, as well as almost all the ages and races, get the disease. But most common presentation would be in a younger patient, 20 to 40 years of age. And African American population has much more a higher incidence of the disease, and the disease seems to be more chronic or fatal in this population. So while there are differences in presentations and incidence, etc., the disease can be seen in anyone. So in the right clinical context, we should suspect sarcoidosis, not just going by, okay, this is the age group, this is the racial mix where we see the disease itself.
Is it a serious disease?
Yeah, so yeah, that's another interesting question. So many patients with sarcoidosis would resolve their disease either spontaneously or with treatment. But in some patients, this disease becomes chronic, and in up to 5% of the cases, this disease can become fatal when you have advanced phenotypes, especially advanced pulmonary sarcoidosis, heart disease, CNS, which is the nervous system sarcoidosis, neurosarcoidosis. So again, it's variable, and that is the interesting aspect, sometimes not so good aspect of the disease, that you don't know how to really give a sense of prognosis, or meaning what would happen to the patient on the get-go. We need to see the trajectory, or how the patient progresses, how the disease and patient interact, and then figure out what would happen to the patient.
What treatment options are available for patients?
I'm going to answer this one, and then Tanya, you can take some questions as well. I don't want to answer all the questions. So
I have questions for Tanya, don't worry.
You do? Okay. Awesome. All right. So treatment options, again, when we talk about sarcoidosis, because this is an inflammatory disease, the first and foremost assessment which we need to make in a patient who's coming in is to see whether they have active inflammation. If they do have active inflammation, which can be sometimes assessed by their symptoms, sometimes by their breathing test, PFT, pulmonary function test, sometimes by their CAT scan of the chest. So rarely we do a PET scan as well to look for inflammation, and sometimes we get help with blood markers. And those type of things, if we make an assessment that yes, inflammation is active and we want to treat that, then we use medications like steroids or other medications which decrease your inflammation and try to decrease the inflammation which is leading to sarcoidosis and other problems which may happen because of the inflammation, like scarring in the long run. So those are one major treatment modality. Now, many times these patients can have other problems, like some patients can have low oxygen. So, you supplement their oxygen. They might have problems with deconditioning. So, you support them with rehab. They might have advanced disease needing transplantation of various organs, etc. And then they might need organ-specific treatment, like if you have heart sarcoidosis and you are prone to arrhythmias, then they might need cardiac devices, etc. So a lot of things come under the umbrella of treatment, but when we generally talk about treatment of sarcoidosis, the most important thing which we are talking about is the anti-inflammatory treatment.
So let's talk a little bit about living with sarcoidosis and managing sarcoidosis. Tanya, you are in regular contact with patients through the sarcoidosis support group here at Temple. What kind of challenges do you hear patients have trying to manage this condition?
Some of the challenges that I actually hear is just the everyday things, whether getting up and feeling short of breath with just maybe doing household work, or like running a vacuum cleaner in that sense, or washing dishes, or just simply going to the supermarket. Those are some of the things, as well as some of the other things could be just if they have small children, caring for their small children because they're short of breath, or because the sarcoidosis has affected their lungs, or because they have the sarcoidosis that has affected their joints, so they're a little bit more achy.
Mm, yeah, and that's a good point, that as Dr. Gupta was saying, that this affects pretty young adults typically. So that would be like a concern, is really just taking care of not just yourself, but maybe others in your household. You know, how is attending a support group? How does that benefit, or how could it benefit patients who are living with sarcoidosis?
Sure. So attending a support group is just that. You get a chance to talk with others, because patients with sarcoidosis can develop depression because you start to feel like, I'm in this by myself, I'm struggling. So with a support group, you're meeting with other people who have the same disease process, that may be actually going through the same issues, medical issues that you're going through. They may also not only give you support, but say, hey, well, I may have tried this, and or I saw this doctor, or maybe for the joints, I became more active, whether exercising, walking a little bit more to make things easier for me.
And you know, what are some of those tips, I guess, that people might learn either from you, or I know that there's many times other speakers from, you know, the different different specialties, depending on, you know, because the condition affects such a wide array of organ types. I know that very frequently you have maybe a cardiologist come in, or maybe a dermatologist, or someone that could speak specifically to the different ways that sarcoidosis affects patients. What are some, I guess, like tips that people might learn at a support group?
Right. So at our support group, we always try to talk about preventive health. Preventive health as what you should do at least once a year when you have sarcoidosis. So that could include just getting your eyes checked every year, because yes, sarcoidosis can affect your eyesight, and you can lead to blurred vision or losing vision. In regards to the lungs, yes, you should see your pulmonologist to have your spirometry, or also known as the breathing test, done. And if you have sarcoidosis that affects the lungs, not only are you seeing the pulmonologist to have the breathing test done, but specialized imaging of the lungs just to make sure nothing has progressed. Having a sarcoidosis, you want to also make sure that you are on a proper diet, and that whatever other illnesses you may have, maybe you have high blood pressure or diabetes, that all of that is well controlled, that your basic labs are drawn and checked every year. In regards to calcium, because we know this is a calcium loving disease, in regards to the type of benign tumors, we'll say, that you form, these granulomas. You want to also make sure that having sarcoidosis, when you look at the fact that it can affect the joints, the lungs, as well as the heart, that you're staying physically fit. You don't want to say, oh, I have sarcoidosis, I'm gonna stay at home and sit in my chair all day. No, you need to get up, you need to move. You may need to, if it's affecting your lungs, talk to your doctor about pulmonary rehab. If you are someone that the sarcoidosis is affecting your heart, that you speak to your cardiologist about going to cardiac rehab. You need to stay active, even if it's not affecting any of the, we'll say, quote unquote, major organs. You want to get up, you want to walk. And so what preventative health tip? It would be, you need to walk, exercise for at least 30 minutes, 5 days a week. So that's a total of 150 minutes. That's very key in health, whether you have sarcoidosis or not. That is a strong recommendation.
Nice. So this is a question that is asked frequently, Dr. Gupta, and Tanya had said something about a benign tumor, and I think people kind of think of tumors and think of, spreading to organs. Is sarcoidosis a type of cancer?
No, not really. Sarcoidosis is not cancer itself. It is an inflammatory disease where essentially all the organ damage is because of inflammation itself rather than cancer, or in medical terms, malignancy. Those malignant cells or cancer cells, in cases of cancer, when they go to different organs and then they infiltrate them and then they produce disease. In this case, that is not the case. It is inflammatory cells which do that. Now, having said that, there are some reports that maybe cancer could be more in these type of patients, especially lymphoma, but there is no real proven data yet. It seems when we the other point which I would say is important is many of the patients, when the first diagnosis of sarcoidosis is made, if the picture doesn't clearly fit, and even otherwise, in the beginning, I'm very skeptical to just make sure that this is sarcoidosis and not anything else, because this is a diagnosis of exclusion. So sometimes lymphoma can present similarly to what we think is sarcoidosis, and it is indeed not sarcoidosis. So you have to be careful about the diagnostic part. This is not a cancer once you have once you are diagnosed with sarcoidosis itself, and then obviously you take care of the health and the disease, and then cancer screening, age appropriate screening, all of those would be similar to the general population.
Tanya, is sarcoidosis hereditary?
To date, we do not have proof of that. I am actually going to defer to Dr. Gupta, but I will say, have I seen patients say that them and their sister or themselves and their mother have had it? Yes. Is it necessarily to say that you can get genetic testing and say it runs in the family? I can't say that. So I'm going to defer to Dr. Gupta.
So no, I think you're right on money, Tanya. I think there is definitely clustering in some families and all, and there can be an increased predisposition if you have those genetic background. Again, this disease is essentially an interaction between your genes and the environmental factors. And in the certain people who are predisposed to have the disease, if you have those environmental triggers which can cause inflammation, is when the disease happens. Now, there are definitely case series. There is data that this might happen to a more extent in families, etc. But again, there is no specific, in inherited diseases, we always say autosomal dominant, autosomal recessive, all those kind of nomenclature, which essentially means out of these many siblings, if you will, X number might get it, depending on the genetic makeup of the father and mother. But this does not go in that way. This is not a genetic disease. It's not an inherited disease. But if you have those genes which might predispose you, which obviously, then in your family you have the genetic makeup which is similar, you might be at risk. Would you develop it if your family member has it? Not necessarily. I frequently get this question, okay, I have this disease, would my brother, sister, or my children would have it? We can't say that, but again, if they have some symptoms which might be suggestive of sarcoidosis, then with your history, the patient's history, that family member should be aware that I should seek medical opinion.
Can sarcoidosis go away and then come back?
You want to take that, Tanya?
Sure. So some patients can develop what we call like a remission, where they're not having a flare. A flare meaning an active disease process where they're sick, they're on medications, and they could be fine, some patients for years. And then next thing you know, the symptoms can come right back, whether it's in the lungs, it's in the skin, their heart, etc. So this is a disease, I'll say it could be waxing and waning, or I'm good, I'm free, and now it's back.
Yeah, I would just add to that people who, some people would have chronic disease, it doesn't go away. And generally, if it does not go away in the initial, whatever, 1 or 2 years of presentation, it probably is not going to go away. Now, those people, even with chronic sarcoidosis, it depends whether they have symptoms or they are okay. So many people live with sarcoidosis as if there is nothing. And many people, we just catch it incidentally because of an X-ray or something else. So it all depends. It can be an acute disease, if you will, meaning it comes and goes away. It could be a chronic disease. It could have some ups and downs, as Tanya mentioned.
There's
Yep.
many different ways that patients.
And that is the interesting part, and again becomes more difficult to manage because you really don't know what the prognosis of that patient would be unless you've followed that patient and they know their disease well.
Mm-hmm.
So another question that we get a lot is it contagious? Can I spread this to my family?
No, it's not a contagious disease.
Tanya, do you find that, I mean, I guess maybe a lot of these are answered again through that it's so variable, right? So it's not a one size fits all, but can patients still work with this condition?
Absolutely. A patient can still work and live a completely normal life, which is key. You can live a normal life, even if you require some oxygen, because as Dr. Gupta mentioned, about 90% of the population, when they develop the sarcoidosis in their lungs. You can, but it really depends on the extent of the disease. Just having the disease of sarcoidosis doesn't mean you are a disabled person.
That's good. That's good to know.
Yeah, and very important because it is, we all know that when we are working, we feel engaged and we need to be distracted as well. Don't focus on this as a disabling disease. Now, granted, many patients can get disability or
Yes.
they can get severe symptoms. We are not undermining that, but at the same time, we all have to overcome the symptoms by this way or that way. So I think it helps. As Tanya said, we always encourage people to be active, be functional, and then support them through the way.
Absolutely.
It sounds like this is an area where there's more research needed. Is there, can you talk a little bit about any current research that's being done for sarcoidosis?
Yeah, that's actually a very important question. We really have a lot of gaps in the knowledge in this field, starting even from like why this happens, right? To how this happens, to how this progresses, what is the patient population who really gets to that bad outcome compared to the other outcome, which is the favorable outcome, which we all want to have. So I think a lot of research is going on. There are models of the disease which are being built now to kind of understand the basic pathophysiology of the disease itself, to see what can we target and how can we stop the progression of the disease, or even better. But those are important things. So that's one. Then there are models and research which is happening on patients, how they do over time, to kind of see what is the natural progression, if you will, of that disease. Again, Another area of research is treatment. So treatment on anti-inflammatory treatment, as well as other type of treatment. Okay, what is the best regimen for this patient? What are the, if we need to decrease the scarring, could there be anything else we can use? What are the patients who can benefit from other medications? Example, when you have pulmonary hypertension, which is a process where the pressure in the vessels of your lungs increases, which could happen because of multiple reasons. There are medications to treat that, but in the field of sarcoidosis, they are not proven. So, some of them have been worked on currently. There are some new data which is coming out. We have been fortunate at Temple Lung Center that we are participating in those as well. And then there is transplantation and data related to transplantation, like what exactly, which are the patients who should be referred if they have advanced disease, etc. Who are the patients who would not do well and they should be transplanted early. So I think almost every field, we haven't talked about even diagnostics. So what is the best serum or blood biomarker of the activity of disease? So these are all places where currently work is being done. Hopefully, we would have a much better evidence-based approach to the disease rather than expert opinion. I mean, we all know that clinical gestalt is very important. We need to have the opinion of the physician who hears to the patient very thoroughly. Okay, what is the symptom? What is the most important complaint of the patient? Then using the clinical gestalt. But if we have evidence, that's what really makes it a personalized field. And that's what we are hoping to reach.
If I can just, I'm sorry, interject
No.
one quick thing, because just, leading the patient support group for sarcoidosis, some patients are sometimes afraid to participate in, research or what we call clinical trials, fearful of what may happen. And what I always like to stress is this: clinical trials / research is not of yesteryear, where people may have heard of bad things.
Yeah.
If you enter into these clinical trials, you are closely monitored by the physician that is running the trial. So if you're here at Temple, by Dr. Gupta, as well as we have our research nurses, you have a phone number you can always call. And in a lot of cases, for some patients, you've been on everything. You've been on the prednisone, the methotrexate, you've been on the Salsep or Imuran. We've tried everything and it just doesn't work. And so we have these clinical trials. And for some patients, these clinical trials is the answer. So I just want to stress to patients that clinical trials aren't a bad thing. This could be your recovery factor in the way of treating your symptoms that you're suffering from for sarcoidosis.
And I would add to that, that's a great point, Tanya. I think many times, like, for example, the pulmonary hypertension we talked about, many times these patients are like, okay, we don't know what to do, and they are left alone till they decompensate. So it's better to be enrolled in a clinical trial where you would have more follow-up and you might get the medication, and hopefully that would not only help you, but the next generation of patients and all.
Yes.
Good point. So we talked about research, we talked about treatment. Dr. Gupta, you started the sarcoidosis program here at Temple. Why is it so important that a patient who has this condition is seen at a place that has a dedicated program, a dedicated center for sarcoidosis?
And that's a great question. I think what I've seen in my career and why I developed this, I was already seeing sarcoidosis patients here. I've always had an interest in these patients and this disease, because when I looked at this disease in my fellowship, I was like, this can really be variable, and we really need a lot of collaboration. It's not just like, okay, I'm going to see the patient, I'm going to do everything. That's just not possible. Many times we need support from other specialties, cardiology, ENT doctors, GI doctors, brain doctors, etc. So that's one part of it. So very importantly, clinical collaboration. Secondly, we need to have education for not just the trainees and physicians and other providers, but also for the patients. So, running patient support group, seminars, these type of events are, in my opinion, very important, because if the patient knows their disease and the patient asks relevant questions, that is when they get more of the answers which they are looking for. Thirdly, I think we are in this day and age in the field of sarcoidosis where we are trying, as I said, moving from the expert opinion or the practice guidelines to really evidence-based medicine. So what is happening recently is we are developing multidisciplinary and collaborative research centers. And with multiple sites throughout the US, across the world. And when we do multi-center studies, we have a better picture of what is going on, and or whether that treatment or any intervention we are doing, or if we are just checking the progression of the disease, we get a better picture of that. And that's much more valuable than, for example, me doing a study on my X number of patients. It is much larger number of patients, many centers, different type of age groups, both sexes, other races. All those things are important to have the study. So I think all the three pillars of academic medicine, the patient care, research, and education, I think that is what the WASOG, which is the World Association of Sarcoidosis and Other Granulomatous Diseases, as well as the FSR, Foundation for Sarcoidosis Research, that is why they came up with the designation of sarcoidosis clinics and then sarcoidosis centers of excellence. And hopefully more data would come from that.
Well, and congratulations. I know that the program here at Temple has been recognized by both WASOG and FSR as a center of excellence. So kudos to you, Dr. Gupta, and to you, Tanya, and everyone who works on the team here that makes that program as great as it is. I have one last question for both of you. What would be, if you had to say one thing that you would tell somebody who is newly diagnosed with sarcoidosis, just starting this journey, what would it be? And Tanya, I'm starting with you.
I would say, never give up. It's only the beginning. And there's plenty of treatments out there and treatments to come. And that here at the Temple Lung Center, not only are we here for you from the pulmonary standpoint, but we got many other pathways to treat your sarcoidosis.
I like that.
Yeah, that's great. I would have a very hard time answering this question because there's never one thing which I say to the patients. But I think most important is, people get very worried about any diagnosis. I would get worried about any diagnosis as well. And sarcoidosis, because there are so many unknowns, there is obviously anxiety around it. So I would say, again, it's okay to have the diagnosis. We will work with you. You need a team, and basically just make sure you take care of yourself. You ask relevant questions, and the team would work with you to get answers. Again, it's difficult many times to get answers in this setting where we don't have too much of data. At the same time, we are trying. So, work with your team and know your disease and body.
I like that. Yeah, advocate for yourself.
Yep.
So we covered a lot of great information today, and I'd like to thank Dr. Gupta and Tanya for joining us and answering these great questions. And if you or someone you know has been diagnosed with pulmonary sarcoidosis and would like to speak to a doctor at the Temple Lung Center, please call 215-395-8237, and we will put that in the post as well when we post this video, as well as a link if you'd like to schedule an appointment that way and have someone call you back. We also, speaking of education, we do have a live education event that will be held online. It's actually this Tuesday April 19th at 2 p.m. And so we'll post a link there as well for you to register. It's free. You will see these familiar faces here as well as some others. And of course, be sure to follow us on the Temple Health Facebook page so you can find out about all of our other future events and live chats. Thank you, everyone, and have a great afternoon.
Thank you, Heather, and everyone.
Thank you. Goodbye.